Hi, MLA Pete Guthrie here. Over the course of 2021, pressures around Alberta's EMS system heightened. A 30 to 35% increase in call volumes made matters difficult for emergency workers, and this led to an internal review of operations with the purpose of finding areas of improvement. From that investigation, AHS developed a 10-point plan to improve EMS services. Now, I'd like to share that plan with you and give some initial input that I received from medics. But before I do, I'd like to provide a few observations. Frontline workers had a tremendous workload increase that stressed these employees and their families, which had a detrimental impact on staffing through holidays, medical leave, sick days, etc. When you have increased call volume with a decrease in available labor, it shouldn't be a surprise that service delivery suffers. One thing I found unusual was AHS's decision to implement a mandatory vaccination policy. When service delivery and capacity issues were abundantly clear, why would an organization implement such a regulation, knowing full well that it would further complicate matters and reduce patient outcomes? I can't wrap my head around the fact that dedicated employees who had served the public for years and throughout the pandemic were suddenly deemed unfit to work and placed on the firing line. And this is done so in a time of great need. Now let's consider AHS's mission statement. It reads, "To provide a patient-focused, quality health system that is accessible and sustainable for all Albertans." To me, AHS management lost sight of this directive. Another perplexing notable lies in the fact that the NDP have been actively supporting mandatory vaccination policies and yet are being heavily critical of service disruptions. Once the left takes a position of supporting the reduction of healthy, available, dedicated frontline workers, union members, I might add, they really lose the right to criticize outcomes. But with that said, we do have something in common. The left and the right both agree that our health system requires reform. And amazingly, both sides are recognizing that private options can be a valuable resource in restoring service levels. So let's look at the 10-point plan. Now, there are 5 actions currently underway. Hiring more paramedics. Number 2, launching pilot projects to manage non-emergency interfacility transfers, including private transfers. 3, initiating an hours of work project to help ease employee fatigue. 4, transferring low priority calls to other agencies. And 5, stopping the automatic dispatch of ambulances to motor vehicle collisions that do not have injuries. The next 5 are actions that are still to come. Point 6, creating a new integrated operations center in Calgary. 7, installing evaluators to determine if an out-of-area ambulance is an appropriate action. 8, implementing a pilot project to manage interfacility transfers by dedicated units. 9, allowing ambulances to be preempted instead of being automatically dispatched by 911. And number 10, developing a strategic plan for EMS delivery. One more additional item includes the formation of a provincial EMS advisory committee to provide actionable recommendations by May of this year. Now, from a budget perspective, I'm told that there has been increases to funding in EMS since 2019 and a 9% increase in staff with more to come. So I'll look to the forthcoming budget to see whether or not we have any future changes. Now, I'd like to say that I do appreciate that improvements can and will be made. This is an excellent start in restoring confidence in our critical emergency services. Although these are very positive steps, there remains some areas of concern from medics who have reached out to my office. First, staff dissatisfaction is a very real concern. It will be important for administration to deal with burnout, improve the work environment, allow for more interactive feedback from frontline staff, and in general, improve morale. 2, there are too many managers and supervisors, which is leading to wasteful spending and inefficiency. They would like to see this streamlined. 3, medics suggest that resources get paired with population growth. And in that regard, local municipal governments focused on growth should pay particular attention to the need for public services in their development plans. If a community or a council is aggressively developing without proper planning in place, it can expect to be underserviced. And that goes for EMS, policing, fire, and primary care physicians. The province does not develop a municipality's growth plan, so councils should recognize the circumstances as they had a hand in creating this environment and work in partnership with the province for improved outcomes. Point number 4, improve public education and awareness around EMS and when it should be called. Number 5, they indicate that 811 is not effective and it requires retooling. And 6, hospital triage will be a key to improving services. And it's not explicitly listed in the 10-point plan, so let's look into this a little bit further because this is significant. Lack of hospital triage has been a growing problem for years. Right now, emergency waiting rooms are full for a variety of reasons. Many walk-in clinics are not seeing patients. COVID or other related conditions are not being treated, so they end up in ER. And in some cases, there is a lack of primary care physicians, which has caused additional strain. Medics are held up at the hospital, sometimes for their entire shifts. Getting an ambulance back on the road as quickly as possible should be paramount. From what I understand, there's a couple of ways to improve triaging. The first is to have medics located in hospital who assume sole responsibility of patients as they are transferred from an ambulance. This would allow ambulances to get back on the road while the patient safely waits for the next available doctor. Another initiative could include having a dedicated physician or nurse practitioner located right in emergency. They'll be there to deal with and treat patients as they wait. A nurse or a medic does not have the authority to treat and discharge, so with this structure, people with minor ailments can be dealt with quickly, which would significantly reduce loads. Anyway, those are a few suggestions I've received thus far, and I can tell you I have had positive engagement with EMS workers, Alberta's chief paramedic, and several members of his team. I believe they are truly attempting to deal with a difficult and fluid situation. EMS has put forward a plan that does require time to implement, and we should afford them that opportunity. I think I can safely say that we all wish them great success, and we're counting on them to deliver. If you wish to provide further comments or submit recommendations on how to improve EMS, please forward those to my office at airdrie.cochran@assembly.ab.ca. And finally, I want to thank everyone for the suggestions and outpouring of support. The feedback from Albertans to these videos has been overwhelmingly positive, and I really appreciate hearing from you. Thank you. Look forward to hearing from you in the future.